And as you guys will know, dentists have to use the pedal at work. So it's been quite interesting this morning trying to trying to use the foot pedal with my foot cramping. Sometimes I'm able to straighten out my my toes, but sometimes I'm not, so unfortunately. So and it's a bit uncomfortable. Let me show you what goes on. So I'll show you what it's doing because it's doing it now, which is why I turned the camera. So it literally just does. So this is my normal foot, and this is my cramping foot, and it literally just does that thing. Then I have to use the foot pedal to get the drills going. Well, my foot is like this. I should probably take my socks off to show you, but you'd have to see my feet, so I won't.
So I'm here with one of my co-presenters, Shafaq, and I think you have an unusual story to tell because you're actually a dentist, which isn't an obvious thing to do with Parkinson's. But before we talk about that, can you take me back to how you got diagnosed and when you were diagnosed?
I was diagnosed 5 years ago, well, more than 5 years ago now, at Doncaster Hospital. So if we rewind about 10 years before that, not long after my youngest son was born, to about, no, probably 9 years before that, 2011, I started falling. My right foot would just roll over to the side laterally, and I would just fall. And it was so much so that I stopped carrying the children because they were only little then. And I would only wear heels if it was a really special occasion. And then from there it progressed to pain in my right ankle, pain in my right hand. That was about 2014, 15, where I started using the dentist pedal at work that we step on to get the drill to work. I moved that from my right foot to my left foot. And then eventually by about 2018, I'd begun to lose my arm swing. I'd started eating food very slowly and not realizing. And I couldn't use my mouse at work without the buttons being depressed involuntarily. So it's not a very dissimilar story to a lot of people, actually. It just took a long time for the symptoms to come together. And once I had the symptom of my hand not being able to use the mouse, I then went to a physio who said, "Sorry, love, you need to go see a GP because your problem's not a little bit of local nerve injury, it's something higher up, so go see your GP." So I did, and the GP duly sent me to the neurologist who then saw me and diagnosed me.
Quite a common story, but I think you get to a point, don't you, where there's enough symptoms that you kind of go, okay, I know what I've got.
But my husband was the one who just sat me down one day and said, "Shafaq, sweetheart, I think you might have Parkinson's. I think it's something serious."
So obviously your day job was as a dentist. You're using the drill in people's mouth the whole day, and it sounds like quite a precarious thing to be doing with Parkinson.
My tremor had never been a problem during the day. My problem was with fatigue. So I noticed again around 2014 that I started to have more rests between taking a tooth out. So I'd be going, trying to get the tooth out, and then, I'll just give the tooth a moment to relax. And in reality, I'd be giving my arm, my shoulder a break. So that got a bit worse. And then it got to the point where I actually had to get colleagues to come and help me because I was that tired. By that point, I couldn't get the final bit out. But apart from fatigue, it actually wasn't too affected in dentistry.
That was the same thing for me. I mean, I had a kind of an office job. I had some difficulty writing and using whiteboards and things like that. But the main problem was I was just exhausted. By the end of the day, I was shattered. I was falling asleep on the train, like standing up, literally, I was falling asleep. And I just got to a point where I realized I couldn't do that any longer. And I decided to take early retirement. But I think you cut down part-time, didn't you? Can you talk me through how that works?
I just went to my dentist, who owns the practice, the principal dentist. I was working 4 days previously. I said, "Could you? I don't think I can work at 4 days. It's too stressful, too intense." And then we talked about me scaling down from 4 days to 3 days, which is what I did initially. And then about 2 years ago, I scaled down to just 2 days. Scaling down any less than that will leave my patients waiting a year for the following appointment. So no, not really feasible. So and I do feel now that I'm an NHS dentist, not a private dentist. So, I'm limited to what dentistry I can do anyway. And now, unfortunately, my symptoms are limiting me even further. I'm finding it more tricky to do suturing, so I don't do stitching, after extractions. So I do less and less of the complicated extractions. I do less and less of the complicated dentistries. I think now, with the fact that my tremor has now started to re-emerge between medication doses, and the fact that my fatigue is becoming a big problem again, I should probably quit while I'm ahead.
You've managed to work for 5 years with Parkinson's, and you're getting to the point now where realistically,
Yeah,
you're probably going to have to stop working. I was
yeah,
actually
it's
the
probably
same. I worked for 5 years. I had 5 good years. I tried to save as much money as I could in that time. And then I got to the point where I couldn't do it anymore, and I just had to take the inevitable route of early retirement.
November, December 2023. I began thinking, oh my God, I think I'm going to have to retire. I was very upset.
Looking at a couple of other things. So, how did your patients react to the fact that you had Parkinson's? Did you tell them?
Some of them I did tell, and they were fine. They were absolutely fine. They trusted that I would stop when I felt it. I needed to stop. The only question mark they had is, how on earth did you get Parkinson's? You're young.
It's interesting. I think people get very worried that they shouldn't tell people at work, that people are going to look down on them at work, and they're going to lose their job or something like that. But I think in the vast majority of cases, most people's employers are very supportive. I mean, perhaps that's not always the case, but I think all the people I've spoken to have had a very positive experience from actually just being honest and open about it.
Yeah, in England at least, the culture is changing somewhat, I'm glad to say. We have a far more open attitude to honest communication and acceptance of chronic conditions like Parkinson's. Unfortunately, that isn't the case in other countries, and therefore I completely understand that other people may feel like they want to hide it. I do feel that is very sad, a very sad situation though, because it feeds into the natural anxiety that occurs in Parkinson's. And that actually is why in this country, some people feel like they can't tell their employers, not so much because of the environment always, but because of their own anxiety.
Have you had any positives that have come out of your Parkinson's diagnosis?
How about heck, man? I met you.
Well, thank you. Yes, I mean that's the one positive I've had is I've met lots of really interesting people like you, Shafaq, and many others, and I've gone to different conferences, and I've sort of got involved in this Parkinson's community, and I've found that's been a real positive actually. I've really enjoyed making new friends.
Yes. So for me, it's exactly the same, basically. I mean, like at Parkon this weekend, I did the welcoming speech and chaired the first session, and I've never done that before. I never thought I would do anything like that. And yeah, I did. It was amazing. I really enjoyed myself. I met such lovely people. I kid you not, I swear the Parkinson's community is probably the nicest community. It's testament to the fact that one of my husband's consultants once said to him, only nice people ever get Parkinson's.
I mean, on a slightly more serious note, I guess, how do you feel about the future? I mean, obviously, you've worked for 5 years since your Parkinson's diagnosis. That's a great thing, but you're kind of getting to the point now where you need to stop. Do you feel quite anxious about the future? Do you feel depressed about it, or are you still positive?
I don't really think about it too much. Why bother worrying about that or tomorrow, which might not even happen. And if it does happen, it might happen in a way that we don't anticipate it. I've already been taught once that if you plan too much, things can change in a moment. You can't borrow trouble from tomorrow. You just can't. You don't know what tomorrow is going to bring. It might bring a cure. It might bring treatments which slow things down. It might bring something else which completely makes Parkinson's pale into the background. So why worry about it too much? I'm hoping that, in the next 5 years, there will be more drugs out there which can help slow things down, and hoping that progression for me isn't too rapid. Let's see what happens.
So for me, one of the hardest thing about Parkinson's is the psychological side. If you can make adjustments to whatever your symptoms are at the moment, but it's that knowing at the back of your mind that it's only going to get worse. I find that quite difficult. You're right, to some extent, you have to not worry too much about the future. You have to park that and just deal with today's problems.
Yeah, not everybody has the ability to compartmentalize. I do because of my work. Work is very stressful, and I sometimes see some not pleasant cases, very sad cases. Not only in my work that I do as a dentist, but also I'm a call handler for a dentist in crisis helpline, and I work with refugees and asylum seekers too. So sometimes I've had to learn to compartmentalize in a big way. And I think that's important. It's a skill I've learned, not to do with Parkinson's, but it's come very in handy with the Parkinson's, because I just park, no pun intended, park the Parkinson's somewhere at the back of the mind, and I just carry on living life.
Excellent advice. Thank you very much. Lovely to speak to you.
Lovely to speak to you too.
So, end of the dental day. I am knackered and my body is tired. I feel the tremor in my leg as well. A little bit by the end of the day. I've started saying bye to my patients now, letting them know, because in England we have like every 6 months checks or every 3 months checks, and sometimes even annual checks for teeth. So some of my patients now I'm saying bye to and letting them know they'll be seeing another dentist. I've been seeing them for about 9 years, so I've gotten gotten to know some of them quite well. They've been hugs, they've been tears, and they've probably been sighs of relief. I don't know. No one said that to me yet, but you never know. So it is beginning to take an emotional toll on me as well, if I'm honest. But I think I made the right decision to finish dentistry now, or at least in the next few months anyway.